Medical conditions not only change the body, but they also change the mouth. And as we get older, unfortunately, we see a lot more chronic and acute medical conditions that impact the mouth. One of the problems is dry mouth, and this is called xerostomia. And salivary is a very important protector of the teeth. And of course, the oral conditions change when you have dry mouth. In fact, many medications actually lead to dry mouth. Steve has been a patient of mine for over 25 years. And about 15 plus years ago, we did some cosmetic treatment on him. And this included porcelain crowns and porcelain veneers. And he had a beautiful smile. Unfortunately, his medical conditions changed and he had some medical challenges. And when the medical challenges came, he ended up getting a lot of decay in various areas of his mouth. This led to abscesses and infections in his mouth, loose teeth, and he actually ended up breaking one of his front teeth because the root decay snapped the tooth off at gum level. When we were considering what treatment to have done, he wanted his old smile back. So we did all-on-4 treatment on him using dental implants and full replacement. You can see here from the photos initially how he has lost that front tooth, but also the fact that you can see his smile has changed dramatically. He has lost many of his back teeth now and has had a huge change in not only the cosmetics, but the way that he functions. When you look at his smile at the end, you can see what a dramatic impact it has had. He has his smile back and he has his quality of life back.